Welcome to the Heart Failure Case Study, a clinical scenario designed to sharpen your diagnostic and management skills. Let's dive into the case of Mr. John D., a 67-year-old male presenting to the emergency department with worsening shortness of breath over the past week. John reports orthopnea, needing 2 pillows to sleep comfortably, and has noticed swelling in his legs. He also admits to a recent weight gain of 3 kg despite a poor appetite. His medical history reveals long-standing hypertension and type 2 diabetes mellitus. He denies any recent infections or fevers. On physical examination, John appears dyspneic at rest. His vital signs shows a blood pressure of 145/90 mm of mercury, a heart rate of 92 beats per minute, and a respiratory rate of 24 breaths per minute. Oxygen saturation is 94% on room air. Inspection reveals jugular venous distension, bilateral pitting edema up to his knees, and bibasilar crackles on lung auscultation. His heart sound include an S3 gallop. Laboratory tests reveal an elevated NT-proBNP of 2500 picogram per milliliter. An echocardiogram shows a left ventricular ejection fraction of 35%. What is the most likely diagnosis? The most likely diagnosis is heart failure with reduced ejection fraction. John has classic signs and symptoms of heart failure: dyspnea, orthopnea, edema, and a S3 gallop. His echocardiogram confirms a left ventricular ejection fraction of 35%, which defines heart failure with reduced ejection fraction. Question 2. What clinical sign point towards heart failure? Jugular venous distension, bilateral pitting edema, bibasilar crackles, and an S3 gallop. These findings reflect fluid overload and abnormal ventricular filling, all hallmarks of heart failure. Question 3. Why is NT-proBNP elevated in this case? Answer: NT-proBNP is elevated due to increased myocardial valve stress. In heart failure, the ventricles are stretched and under pressure, stimulating the release of natriuretic peptides like NT-proBNP. John's level of 2500 picogram per milliliter is significantly above the normal range, supporting the heart failure diagnosis. Question 4. What does the S3 gallop indicate? Answer: an S3 gallop indicates volume overload and impaired left ventricular function. The S3 sound occurs during early diastole when a large volume of blood strikes a compliant left ventricle, which is typically in heart failure with reduced ejection fraction. Question 5. What further test would you order? Answer: coronary angiography to check for ischemic heart disease, chest X-ray to assess pulmonary congestion, renal function tests to check the kidney involvement, electrolytes to guide medication choice, and Thyroid function test, as thyroid disorders can exacerbate heart failure. Question 6. How would you classify the severity of his heart failure? Answer using the New York Heart Association classification. Class 3. Marked limitation of physical activity, comfortable at rest but less than ordinary activity causes symptoms. Question 7. What medications should be initiated immediately? Answer: beta blockers, example bisoprolol, ACE inhibitors, ARBs, or ARNI, example enalapril, valsartan or sacubitril. Loop diuretics, example furosemide for symptomatic relief. Mineral corticoid receptor antagonists, example spironolactone. Question 8. Which lifestyle modification would you recommend? Answer: sodium restriction, less than 2 gram per day, fluid restriction, 1.5 to 2 liter per day, daily weight monitoring, regular low-intensity exercise if stable, smoking cessation, and alcohol limitation. Question 9. When would you consider device therapy? Consider implantable cardioverter defibrillator ICD for LVF less than or equal to 35% despite optimal medical therapy. Consider cardiac resynchronization therapy CRT if LVEF is less than or equal to 35%, QRS duration is greater than 150 milliseconds, and symptomatic despite medical treatment. Question 10. What is the prognosis for John? Prognosis depends on response to treatment, comorbidities, and adherence to therapy. With optimal medical therapy and lifestyle changes, some improvement can be expected, but heart failure remains a chronic and progressive disease. Thank you for watching. Please don't forget to like, share, and subscribe for more medical tutorials and case discussions.